Hi, Cathy. Thanks very much for being willing to come and speak to us about how to build research active careers. The first question I'm asking everyone is, could you just say a little bit about your research background?
Yes, so thanks very much for inviting me. So I'm currently an NIHR Research Professor, which is a 5-year post funded by the NIHR, which is essentially like a fellowship where you're predominantly doing research, but you can integrate that with clinical work. And it's really about sort of helping people to develop their research leadership and move their research forward. So that's kind of where I am now, but it's been quite a bumpy, probably windy road to get to this point, with quite a lot of gaps and bits of uncertainty along the way. So I started off before my clinical training working in a research assistant position. So it was a very clinically relevant research assistant position. So I'd had some background in research before my clinical training. And during my clinical training, I did particularly enjoy the research components and did publish various things during my training, including some of the case reports and service-related research, and a few things from my DClin thesis. So it's definitely was something that I was quite motivated by at the time. As I was coming to the end of my clinical psychology training, a couple of posts came up which were quite unusual, which were at UCL, and UCL and Camden Islington NHS Trust came together and created some junior clinical research fellow posts. And actually, well, they advertised one, which Emily Holmes got. And then because I had been very much talking about doing research in child and adolescent mental health, they created another post to go alongside that, which was more focused on child and adolescent mental health. And so it was a really amazing opportunity because it was a 3-year post, and half the time I was doing a PhD focused on the development of anxious cognitions in children. And the other half of the time I was actually kind of on rotation around the different children and young people services in Camden Islington. So I got experience working in a number of different settings. So it was really fantastic grounding. So during that time I finished my PhD, and when I came to the end of that period, I was introduced to Lynn Murray and Peter Cooper, who are professors at the University of Reading. And they brought together what I was really looking for at that time, which was that Lynn's a developmental psychologist, Peter is a clinical psychologist, and they sort of brought together different areas of expertise that I really wanted to learn from. So I took a role as a postdoc with them, a clinical postdoc, but it was actually quite a short-term post. I think it was just for a year in the first place. So I moved from London to Reading, quite pregnant, with a very short-term contract, not really knowing what was going to happen next, but it seemed like a good opportunity and a good move at the time. And essentially that post came to an end, and then I think there were other bits of funding, and essentially I was applying for things all the time at that point, and there were various points where I had several different applications on the go, not knowing if any of them were going to come off in the end. I think I covered bits of people's maternity leave and that sort of thing, but eventually I was successful in getting an MRC Clinician Scientist Fellowship, and that basically then gave me, I think it was 3 years of funding, but I had some maternity leaves in it and some part-time working, so it went on for more like 5 years, I think, in the end, which allowed me to really focus on clinical research. And then at the end of that, the University of Reading gave me a year bridging to sort out the next thing, and during that time I got the NIHR Research Professorship, which I've been doing for the last 4 years, and I'm just coming to the end of it now, and I've recently moved it to the University of Oxford. So that's kind of the journey that I've taken. So I think from out the outside it might look like quite a smooth journey, but I think it's really important to emphasize that there have been quite a lot of periods of quite marked uncertainty along the way.
So it sounds like you've had to build really good links with people, be prepared to cope with uncertain job prospects in the future, and have lots of applications that don't all come off.
Yeah, absolutely. And I think the lots of applications that don't come off is a really important thing to emphasize. And I think sometimes it can look like people are being successful getting lots of grants, but what you obviously don't see is the number that have gone in around that. And I mean, certainly in Reading, there were times when Peter Cooper and I were asked to do a workshop on, getting grants. And what we reflected when we looked at it is actually what tended to happen is we just never let go of them. So when we submitted something and it was unsuccessful, we just wouldn't give up. So we would then take the feedback, work on it again and keep it going. And there was one particular project, which was a really large grant, but I think we thought it was about 4 years in the making of, one grant application, rejected, get feedback, go again, etc., etc. So lots of persistence.
Okay, so thinking back to the early stages of your career when you were just starting to get PhD funding and early fellowship funding, what top tips would you give people about how to follow the path you took?
Yeah, well, I think for the sort of fellowships that are open to us, I think this goes for postdoc fellowships and also, if people are interested in doctoral fellowships, the key thing is really demonstrating a commitment to clinical research, because these opportunities, these funded opportunities are a major investment from whether it's the NIHR or any of the other funders. So they have to be convinced that you are committed to, developing clinical research. And so being able to demonstrate that commitment is really critical. And the ways that funders are going to be looking for that is obviously evidence of appropriate training that you've had. So if it's applying for a PhD, have you done a master's? If you haven't done a master's, have you been involved in other research projects where you've had opportunities to learn? And obviously publications is a really important one and a very clear way of showing your commitment to clinical research. Have you taken opportunities to share results of research that you've done, and have you made that happen? And I think those are some of the kind of critical things. And so I have tried, I think early on I was taking opportunities to sort of make sure things get written up, pushing things through to publication, despite the fact that there might have been kind of competing things going on at the time.
So if you were someone who is in a predominantly clinical role trying to build that track record to then get funding, have you got any tips for what kind of research they can be doing alongside clinical work that can demonstrate that?
Yeah, I mean, I think the thing is, in clinical work, there are so many unanswered questions. And actually, there are things that people are doing in their day-to-day work that can really contribute to answering some of those questions. So I think it's looking out for novel pieces of work, whether it's case studies that can be presented, or whether it's service evaluation type projects. Whenever there's a sort of novel piece of work that other people could learn from, then it's worth thinking about what might be a good way to share that. Also, sitting on panels, NIHR fellowship panels, etc. You do see that a lot of people may have also got publications through writing kind of opinion type pieces and commentaries, which is, also a really good way just to kind of show that you're really thinking about this area and that you're kind of committed to it. So those sorts of things can also be quite useful exercises, I think.
So with your experience of sitting on funding panels, I think you've sat on the doctoral panel and the career development panel for the NIHR. Are there any things that you've thought, oh, that was a near miss if only you'd done this, or this was a particularly great thing that really helped push this above the bar?
Yeah, I think one of the things that makes projects really stand out is a very clear awareness of how the proposed research is really going to make a difference and how it's really going to be implemented in practice. So, I mean, this is a very NIHR perspective from sitting on NIHR panels, but if, for example, people could come along and have come up with an idea for the most fantastic intervention, which looks like it could, be really, really effective, but if they haven't thought about actually how it would get into practice and how it would actually get used, then it's going to be hard to convince that NIHR panel that this is something that they should invest in, because they'll be thinking, there's lots of different interventions people could do, but is this really going to get used? And if we're going to invest this money, we need to know that it's going to make a difference to the NHS. So it's where it really stands out, where people have a very clear, can really clearly articulate the NHS or social care need or public health need, and how this is going to fit within the current setting you know, and I think clinical psychologists are obviously in a great position to demonstrate that. So particularly if they're currently working in a practice and their research ideas are reflecting the needs that they're seeing on a day-to-day basis, and they're aware of the workforce that would need to deliver a particular intervention, if they're aware of the training that would be required, you know, and how they would make those things happen. So I think showing that kind of realistic understanding of the context is really important. I mean, other things I think that people will presumably already know about, I mean, obviously for the NIHR, involving patients and the public in meaningful ways is absolutely critical. And if you haven't done that, you don't stand a chance. You can have the most brilliant science, but if you haven't actually spoken to anyone who could potentially benefit from it, then it's not going anywhere. And I think it can't be overemphasized how early that needs to start. And really what you would hope is that your research ideas have at least been influenced right at the beginning from conversations with patients and members of the public with relevant experience who've helped shape the idea for what's actually needed. But then you need to be thinking about you know, how you work with patients and the public all the way through. So right from thinking about the idea, what research is needed, what's going to make it work, how it's going to be implemented, how they can make sure that the project's a success and that you can recruit effectively and it's acceptable to people. So, you know, thinking about how you involve patients and public all the way through. And that goes for every kind of project. That's expected for, you know, it could be a statistical project, which is all about, you know, using data, not going out and actually collecting data from patients, but that still needs to be there.
Great. So a lot of clinicians might not feel that they're as well networked as you were when you were tied into UCL and you had good academic links from the get-go. What would be your advice about how to build the team of expertise around you?
Yeah, I mean, I think finding people who can offer you good mentorship from the start is really, really important. And it's something that I've benefited from enormously, you know, good role models and good mentors. And what you would hope that those mentors, one of the things that those mentors do is help link you up with other people, make introductions, you know, flag up other people that might be good people for you to speak to. So I think that's a first step, and obviously that's something that you and I, Barney, can help people with through our role as NIHR advocates for practitioner psychologists. You know, we're really keen to help make introductions and set people up with people who might help mentor them and give them some advice, even if it's just on an informal giving some advice basis. So that's a really good way to start. Also, I think people shouldn't hold back from just making direct contacts, you know, so having a look at who is doing the key research in your particular area, who are the people that, you know, where you're excited by their work, the people who inspire you, who you read their papers and you think, yes, you know, they're thinking about this in the same way as me, and don't worry about contacting them, but drop them a line, because many people will be really keen and enthusiastic to help people develop more research in these areas. You know, in mental health, we've got such a problem with research capacity that I think that's so widely recognised that, you know, if there's opportunities to help more people develop clinical research careers in this area, then I think most of us are really keen to help with that.
Absolutely. So is there anything else you think we should be asking you about how to build a clinical academic career?
Good question. I mean, I think the things I would really want to emphasize is that it's not, you know, it's not a straightforward path. And as I said, you know, my experience was there's quite a lot of uncertainty, you know, and there'll be bits of, you know, uncertainty about where the next bit of funding is going to come from.
You haven't sold it to people yet. Why should anyone actually want to bother with this research stuff?
So I think you've got to be prepared for that. But I think that, you know, the benefits are that, you know, I think anyone working in clinical practice will be really aware of all the unanswered questions there. And there will be frustrations about what we should be doing about these particular things. There'll be particular challenges that we're desperate to know about. And we really need to know about them. And I mean, and personally, I find it really rewarding to be able to answer some of those questions and to do things that are going to make a difference to practice, make a difference to, in my case, children and young people's lives. It's such a rewarding thing to be able to do. So I think those, you know, that's the biggest benefit. There are other benefits as well. We have, I think, as researchers, we have a bit more flexibility probably than people working in clinical practice. because our days are, you know, not always, but to some extent, a little bit more under our control. You know, we can take our research in particular directions. You know, we have other kind of you know, criteria we need to meet for our employers, but you know, there is a certain amount of flexibility in that allows us to kind of keep doing things that we're really fascinated by. Does that sell it a bit better?
It does. Yeah. Okay, thanks, Cathy. That's amazingly helpful. I'm going to stop the recording now.
Thank you.